Throughout the last couple of years, there has been a noticeable growth in the popularity of a dietary movement known as vegetarianism. An individual who follows the dietary restrictions placed by vegetarianism is referred to in most cases as a vegetarian. This is an individual who does not consume or condone the consumption of meat, fish, or fowl. However, this is the most basic definition of vegetarianism. In fact, there are actually 7 specific categories of vegetarianism that focus on different types of dietary restrictions. The most extreme of the vegetarian diet is veganism, which is the complete omission of any animal product, eggs, dairy, or honey within the diet, and in many cases, the refusal to wear or use any materials derived from animals, such as leather. The next most exclusive diet consists of fruitarians, individuals who only eat plant components that can be gathered with no harm done to the plant. This differs from vegans because vegans include grain in their diet. Lacto-vegetarians include dairy in their diets, but not eggs, and lacto-ovo-vegetarians are actually what are most commonly thought of when hearing the word vegetarian, individuals who just exclude meat. Pesca-vegetarians and polo-vegetarians include fish and fowl in their respective diets. The least exclusive vegetarian diet is flexitarianism, which is categorized by the occasional inclusion of meat products in the diet. With the growth of popularity in vegetarianism, especially its most exclusive subcategories of veganism, the question arises, is it healthy for an individual to exclude such a large number of foods from their diet? Recently, studies have been looking into both the advantages and disadvantages of veganism in terms of its long-term effects on health. The most commonly associated advantages of veganism begin with the fact that vegans do on average tend to be thinner in appearance. Because vegan diets tend to be lower in calories, fat, and cholesterol, on average, vegetarians have a lower risk of cardiovascular disease, obesity, type 2 diabetes, and some cancers. Along with these advantages, there have also been studies that show there is a chance that veganism can lower the chance of osteoporosis, and with the high intake of whole grains, it is also probable that this diet lowers the risk of colorectal cancer. Furthermore, because vegans consume a greater quantity of fruits and vegetables, which contain high amounts of fiber, folic acid, antioxidants, and phytochemicals, the risk of stroke and death by stroke is greatly reduced. Although there have been a number of studies that support the claims of veganism as a healthy dietary choice, there have also been research studies that have shown potential shortcomings of this extreme diet. In terms of these disadvantages, the vegan diet is lower in N3 polyunsaturated fat, lower in vitamin D, lower in iron, lower in B12, and lower in zinc. Because of the recent increase in popularity among teens, young adults, and women, the level of available information has grown regarding veganism. Many doctors and nutritionists are now developing ways of compensating for the shortcomings of the vegan diet to make up for the possible deficiencies. These may include taking dietary supplements such as vitamin pills and concentrating on eating fortified foods such as fortified soy and rice milks, cereals, yeast, taking B12 tablets, certain juices, and vitamin D supplements. Because there is such an increase in the knowledge regarding how to maintain a fully healthy diet while also maintaining a vegan diet, I believe it is reasonable to assert that a vegan diet is a healthy one. However, although there is an infinite amount of available information regarding the vegan diet, there is still very little definitive knowledge in terms of the actual benefits and disadvantages the diet poses on the body. There is still much to learn in terms of the long-term effects of this type of dietary restriction.